Oh, it's not your time, but let me be sharing the link. We have 10 minutes to go. Thank you. You're all welcome. Quick share. Okay. Share it to Facebook. Oh, welcome. You're welcome. Thank you for joining. Sure. Let's discuss. Join the live stream. It's almost. Join my live stream. It's almost 11. We are going to pardon the noise. Everybody is going to pardon me. I hope network will free me very well. If you have joined the live, say I put your eye in the comment section. So we discuss better. Yup. Let me see someone say I. Thank you for joining my live. You're all welcome to my live. So we are going to be talking about Candida infection. The noise is too much here. But it's almost too time for a live stream. I think there is a lot of noise here. But we are just going to endure that and work with that. Thank you for joining. Yeah, I can see one person have already joined. Thank you for joining. Yo, it's almost 11. Okay, it's almost 11. I said I'm going to start at 11. Please, thank you for joining. So I am pharmacist God's Gift, okay, a practicing community pharmacist for now. I'm pharmacist God's Gift, and on this channel we'll talk about health, everything about health, about lifestyle. Yes, my lifestyle. I add my vlogs, all things, sometimes things I do for the day. I add myself, my family. I also make this place like my home, and the people that have been following me already know how we have been going. But it's mostly about your health, and we talk about the health. Sorry about the noise, the background noise. I'm at work, and the place is closer to the road, so we hear these tricycles, keke na pepe, and cars, everything. So sorry about the noise. The noise is gonna affect us, but sorry. Please, if you're joining me, like, I know you say, what have she said that we want to like? Yes, she wants to say a lot of things. Yes, because the month has ended. Okay, so that is all about me. Thank you for joining. Okay, I'm a lady pharmacist. Thank you for joining. So the month have ended, and a lot of persons usually after seeing their periods usually have all these candida infection. Apart from that, candida is like a normal thing in every lady's body, but when it comes to candida infection, okay, time, we already have 5 minutes. A lot of persons usually have it. Okay, so today I want to talk about the natural remedies, the drug therapies, prevention, all about the candida, how you can even get it, how it all come about. And also there are some questions that we are asked when I made a video, when I make a live stream about how to use one insert, how to use insert. Somebody was asking me if one pink tube is going to be inside of you. A lot of questions were asked. Okay, so today I'm going to answer some critical questions too, so you need to join the live. That is why I posted the live on Facebook, on WhatsApp. I even posted it on my community here on YouTube. So you need to join this live. If you are a guy, you need to join it. It's not because you are a guy you think you don't have candida. No, now you are a guy, you can educate your female friends. Okay, you can educate your female friends on how to go about this, because some ladies are usually careless about their health. So you as a guy, you can educate them. Okay, so I'm going to be talking a lot about that. Okay, so let me see how many minutes we have to go. 3 minutes more. Join, 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 join. I don't want to start talking when no much presence is here. So it's gonna be a freestyle. You're going to be asking me, dropping your questions. I'm going to be answering your questions today. Drop your questions, or not when I'm done with the live. I will now be seeing the questions. I will want to answer you. Your name, just drop your questions here so that I can see and answer any of such questions. You can drop them. Sorry for the background noise. I'm closer to the road, so you'll be hearing the noises from the tricycle and thereabouts. Okay, so you can all drop your questions in the comment section so that I can answer you, and give this video a like, a like, a like. So today is all about fungal. Okay, so we have some minutes more to go. Some minutes more to go. All the questions that you have concerning fungal infection, be thinking about them. Be thinking about them so that you will drop them today. Okay, so if you're a pregnant person that is joining this live too, be thinking about the questions you have for me. Pregnant people, pregnancy comes with a lot of challenges when it comes to Candida. Okay, let me write that down so that I'll be able to talk about pregnant people and this infection. If time permits us to reach that, I'll be spending 1 hour 30 minutes. So pregnancy slash Candida. Okay, so if time permits me, I'll be spending that. So that is it. So if you're joining me, you're following me, like, like, let's know where we are going. Thank you for joining. Thank you for joining the live. Today you are going to see all the pink tubes, all the pink tablet, and all the yellow tablets, and all there. But I'm still going to teach you how to insert. I'm still going to teach you how to insert it. I'm even surprised that a lot of persons still don't know how to use insert. Well, as some are growing, others are being given birth to. Okay, so the one that has been given birth to are still learning. So the grown one have known, then the one that they've given birth to are still learning. So it's kind of a continuous process, a continuous unending process till the world ends. Yeah. So we are still going to be talking about, even though you have heard it, there is some person there that have not heard about it, that are experiencing this thing but don't know what is actually the cause. Okay, so you can share this video out to them too. Okay, yes, time is 11 a.m. Thank you all for joining the live section. Today we are going to be talking about Candida infection, how to manage Candida infection with or without drug, and also we will be talking a lot. Okay, so I'll be having one or two. Welcome, man. I want to get something.
Sorry, I interrupted your picture.
Okay.
She's running the
Okay.
The other lady is no longer here.
Okay. Hi, Nadera Clinton. Clinton, I'm coming. Please, you have to give me a minute. I'm coming. I'm coming. We are still going to continue the live. I'm coming. Actually, I'm on the live.
Okay, sorry.
my God. Hi, Clinton. I'm sorry for that. That's okay. Sorry for that. I needed to go attend to something. Okay, you're all welcome. Please, I'm sorry for the distractions. Okay. I told you that I'm at work and I was attending to a client, a patient. Okay, so sorry for the distraction. You're all welcome back. Sorry. I'm so sorry for the distraction, for keeping you guys blank without anyone attending to you. Okay, Iham, yeah, Hub. Okay, you're all welcome. Please like. So we are going to be talking about candida infection today. So a lot of persons have been hearing about candida. What is candida? What is infection? Okay, candida infection is yeast infection. Okay, it does not, what I want you people to note today and right now, that it does not occur only in the female. No, candida infection does not occur only in the female. It occurs both in the male and female. Okay, so if you're a man and you're feeling this life does not concern you, please, it concerns you a lot. It concerns you. So you need to follow me, because it occurs both in the male and in the female, not only in the females as you all would think. Okay, so candida infection is normally we call it candidiasis. Okay, candidiasis, which is a candida infection that is caused by the fungus candida. Okay, for female, our system usually we have naturally we have candida in our system. Okay, thank you all for joining. Please like and say I. Please like and say I if you're following, and if you have any question, you should put it in mind and drop it. Today is going to be a long time. If I will be going to attend to some people and I'll not be here, please, you have to forgive me on that, because today is going to be a long day. Okay, so as I was telling you about, candida infection is caused by a fungus. Okay, and the fungus is the candida. Candida is the fungus, so they usually call it candida infection. The candida, which is the cause infection. For ladies, we usually naturally have this candida in our system. We have it as a good fungus that helps to regulate a lot of things in our body. Okay, but when there is an overgrowth, of this infection, that when there is an overgrowth of this candida, that is when it now becomes a problem. Okay, I think my mic is off. So when there is an overgrowth of the candida, that is now when it becomes candida infection. That is now when it becomes a problem. So a normal candida being in your body is not a problem, but if there is overgrowth of that candida, is now what we call the candidiasis. Okay, is now what we call the candida infection. Okay, that is all about what is it now. So if you are not understanding me, you're not getting me, you can still drop it down, because today I'm going to be talking about the drugs, I'm going to talk about natural remedy, I'm going to talk about a lot of things. Okay, so that is the cause of candida infection. Now let's talk about what you do that gives you that candida infection. What makes that candida overgrow? How will a normal candida in your body, in your VG down there, a normal candida, okay, let's call it she, a normal candida in your she, why will she just overgrow like that? So there are some things that you are doing to your body that are not right. Okay, there are some ladies that like to put on tight clothing. Like you will see them put on clothing that will not allow any air to get into this candida. It will not allow the candida to breathe very well. Okay, that can actually cause overgrowth in the candida. Okay, and also there are some persons that like keeping themselves always damp. when you go use the bathroom, you ease yourself. You need to dry up yourself. You don't need to keep yourself damp, okay? Your undies, if that urine, that dampness, that wetness touch your undies, and over time within the day, they can make that candida to overgrow because there is dampness down there. And this candida, okay, I say sorry for the noise, and this candida usually likes a very damp area so that it can grow and multiply. Okay, so that too usually makes the candida to overgrow, thereby leading to candidiasis, which is the candida infection. So all you need to do as a lady is try as much as you can to prevent dampness down there, and also as a lady try as much as you can to put on clothes that will allow air, fresh air into your body, okay, so that the candida will not overgrow. Thank you all for joining. This is thank you all for joining. Okay, so that is it. Now let's talk about the symptoms. You know, when something gets into your body, when the candida overgrow, there should be some symptoms in your body that will show you that, hey, there is a problem in your body, there's an infection in your body, so you need to work towards it and get rid of it. Okay, the symptoms of candida infection, that is what we want to talk about. So if you're a guy, if you're a lady, and you know you're having candida infection, there are some symptoms, there are some things your body will exhibit. Those are what we call the symptoms. Okay, it's raining down there, so it's not that bright. Let me see if it's brighter this way. Okay, let's see how it goes. Oh, today is a rainy day. I never knew it's gonna be a rainy day. So there are some symptoms that your body is going to exhibit, and one of them is itching. Yeah, itching. That is called scratching. Okay, normally some people used to say scratch. That is pidgin English. We say, they scratch me, my down, they scratch me. Okay, it's itching. Okay, you have this itching sensation. Some people can scratch for you as very bad as I've seen someone walking on the road that was scratching. I said, calm down, it's okay. So itching is number one symptom of candida infection. Okay, itching vagina. Okay, you want to scratch your down there. Okay, then number two is inflammation of the vagina. Okay, you will notice that the vagina will be swollen. Yeah, because probably you have scratched it too much because of this itching. You have scratched it too much. There will be inflammation of the vagina. Inflammation means swelling. No, please, swelling of the vagina. Okay, and also there are some persons that usually have discharge. Okay, these are one of the things that you will see. That is what I'm telling you. These are the things that you will see. Okay, itching of the vagina. And I said inflammation, also inflammation of the vagina, and also I said thick white discharge, a discharge that is thick, a discharge that is white, and it smells. It has this foul smell. Okay, I've made a video and I've showed how the discharge is like. Okay, the discharge usually most of the time used to be like this cotton wool. Yes, is white like this cotton wool. You will see that something white like this to be in your panties. White will be in your panties. Okay, and for those that usually put their hands in their body to wash, yeah, because there are some people that say they put their hands in their body to wash, you will see that you will have this discharge, and the white discharge very thick. That is very thick. You can see this is very thick. Okay, you will see something very thick coming out of your body, and this discharge can be smelling. Okay, it can be very smelling. Thank you, Yamzi. Thank you very much. I appreciate. Thank you for joining. Thank you, fam. That is our pharmacist, Yamzi. Okay, thank you. Please like. So the discharge can be very smelling, thick discharge that can be very smelling. Okay, then another one is pain during sexual intercourse. Yes, pain during sexual intercourse. These things I'm saying I know you don't. Okay, I will tell you what the men will usually feel. Okay, since the men don't use. Okay, some men to have discharge. Yeah, yes, I've seen fungal discharge in men. Okay, I will get to that. Okay, let's continue first. Okay, so pain during sexual intercourse, painful experience during sexual intercourse. That is another, and also pain or discomfort during urination. There are some persons that when they urinate, they'll feel those painful urination and incomplete urination too. That is a sign of candida infection. Okay, and also it can also be a sign of mixed infection, that there might be bacteria that is accompanying this candida. Okay, when this candida overgrow and it causes this candida infection, which is the candidiasis. Okay, there are chances of bacteria also getting involved in the process. Okay, so for the male, usually they have itching, also severe itching, and also they can have discharge. Male usually produces this discharge. That is why you will see that some male, they will tell you when they are urinating, you will notice discharge from the urine. Okay, that is to show that there is serious candida infection in the male. Okay, serious candida infection. I've seen urine sample that you will see the discharge in the urine sample. Male to have candida discharge, so don't be surprised. Okay, if you're joining me, please please like and say I, please like and say I. Okay, so that is it about the male. And also males have discomfort during urination and sexual intercourse too, apart from the itching and the inflammation. So all these things that the female experience, the male also experience, the male also experiences them. Okay, as signs and symptoms of fungal infection. Okay, so thank you guys, please like, thank you for joining. Indira Clinton, thank you for joining. Thank you. So those are the signs and symptoms of candida infection. I know there are still a lot that you will see, but these are the common ones that usually almost 99% of persons that have candida infection comes out with. Okay, 99% of persons that have candida infection usually comes up with itching, inflammation, thick discharge. Sometimes the discharge is not white, sometimes it's yellow, like they used to call it cheese like. Okay, but it's kind of yellow. Sometimes I'm thinking of what I will use to represent this yellow type that I'm talking about. Okay, sometimes it comes like sometimes it comes in a painful way. When you're having sexual intercourse, it's usually painful, and when you are urinating, it's very painful. Sometimes if you think that it's gonorrhea, sometimes candida infection will make you feel as if it's gonorrhea, but when you go carry out some laboratory tests to check, you will know that you don't even have any gonorrhea. It will be that it's just candida infection and probably E. coli that is causing that. Okay, so those are the signs and symptoms. Please join. We have spent 19 minutes so far. Please join. Join the live stream. Join the live stream. Thank you for subscribing. Thank you for joining. Okay, so let's talk about pregnant people. Hello, pregnant women. I am talking about you right now. So pregnant persons usually have the symptoms too. Okay, pregnant persons are always prone to candida infection because their immune systems are very low. Okay, in this process of pregnancy, they are sharing their immune system with their babies. Okay, so their immune system is low and is always prone to infection. They can get infection easily, especially candida infection. They can have it ASAP. So the pregnant woman too usually experiences these symptoms that I mentioned. They usually have pain during urination, pain during sexual intercourse, and discharge, foul-smelling discharge, and also itching down there too. Okay, so those are the signs and symptoms that the pregnant woman do experience too. So pregnancy is not different from pregnancy. The candida you face is not different from the type of candida you will face when you're not pregnant. Okay, pregnant, not pregnant, man, woman, they all have similar symptoms when it comes to candida infection. Okay, so now when candida infection is very contagious is when it has started bringing out this red rash. Okay, these red rashes, when you have itched to the point that there are rashes that is now bringing out water, fluid, is now very contagious. Okay, so now if you have sexual intercourse, apart from that, even if you're having the symptoms and you have unprotected sexual intercourse with your partner is at, you can easily transmit candida infection to your partner. Okay, so that is it about the same and pregnant people. Why I say one of the reasons why I choose this topic to do at this time, like this is the third day of the month. Okay, third day of the month. So why I choose this topic is because a lot of persons, after seeing their period, after seeing their monthly flow, they usually have candida infection. Probably that should be because of will I say some persons don't okay, some persons have poor hygiene. Okay, poor hygiene during their menstrual cycle. Okay, so most at time they usually have candida infection after their flow. Okay, so that is why I'm doing this live stream now, so that you'll be able to understand your system and look for way to get yourself out of this situation, so that after seeing your period you won't go and have candida. Okay, that is it. Thank you for joining. If you're joining, say I, please comment, like, comment and 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 like. So now I've told us I've told the causes, I've told you what causes candida, the symptoms you will feel in pregnancy, the symptoms you will feel when you're not pregnant, and also I've told you the symptoms in male. Okay, there are symptoms in male, there are symptoms in female, and I've also told you the symptoms you will feel when you're pregnant or not. If you're having any issues, you can drop it down in the comment section. Join. You can drop it down in the comments. We have known what it is. We have known how to take care of. We have known the causes and the symptoms. Now let's look at how to take care of it. There are different ways to take care of it. There are natural ways. There are drugs that you can use. Also, there are supplements that you can use to get rid of candida infection. Okay, now let's look at the drugs. You know, the drugs, there are drugs that pregnant women can take, and there are those that pregnant women cannot take. Okay, so if you're a pregnant woman and you are following me this my life, you should take note of the drugs that you can take and the ones. Okay, so I told you I'm going to also teach you how to use the insert, and someone was asking question also of a yellow tablet inside of the person or not, and if they can have sexual intercourse while on this drug or not. Okay, so I'm going to be looking that. So the drugs that we are going to use, since it's a fungus and it's caused by fungal, we are going to be using antifungal. Okay, there are some classes of drugs that are called the antifungal. I know that you must have heard of these antifungals. Okay, am I too fast? Say too fast. You can comment too fast, slow down, calm down. You can comment that in the comment section and we will know. Okay, put that in the comment section if I'm being too fast. Sorry for the network is raining over here. So I want to talk about the drug, and I said it's antifungals. Okay, antifungals are drugs that are made to destroy, to kill the life of a fungus. Okay, to prevent the overgrowth of a fungus. Okay, you know, in our starting I told you that fungi, the fungus, When I'm calling fungus fungi, don't be confused, they are still the same thing, okay? Are natural things that are found in the woman, okay? And I told you that when they overgrow, that is when they now become an infection and the problem, okay? So these antifungals are drugs that are made to stop the overflow of to stop the overgrowth of this fungal, okay? They are meant to stop the overgrowth of this fungal, to destroy their growth, so that they will be at a minimal good level that will be able to give your vagina the effect it wants, okay? So these are some antifungal drugs that are out there. Okay, with antifungal drugs, we have your fluconazole. I know a lot of persons have seen this before. You have your fluconazole, and also you have your itraconazole. Itraconazole too is an antifungal that is out there. You can see that it's also written you can see it's written candidiasis. Candidiasis, that is what I've been talking about. Candidiasis. When the candida has started causing an infection, it becomes candidiasis, okay? So this is candidiasis. You can see that you can see that, okay? So these are some of the antifungal drugs out there. There are a lot of antifungals out there, okay? We have the ketoconazoles too that are antifungal drug out there, okay? Some are made for the skin, some are made for fungal infection that has to do with the vagina, okay? Okay. So these are the tablets that are there for fungal infection. So to the pregnant women now, you are not expected to take any of these tablets. None of these tablets concerns you, okay? So if you're a pregnant person and you're streaming with me live, you're following my life, don't take any oral antifungals. The oral antifungals are not made for you, okay? The oral antifungals are not made for you. The oral antifungals are not made for you. The oral antifungals are not made for you if you are pregnant, okay? Then if you're not pregnant, you are a male, you're a female, you're not pregnant, you are not breastfeeding, please, you can go for the oral antifungal tablet that I just showed you right now, any of them or other ones that are available out there in the market, okay? So if you're breastfeeding too, you don't need this too. Breastfeeding mothers too don't need this. Only those that are not breastfeeding, those are the ones that need this, okay? That is for the world people that are not breastfeeding, okay? Then also I have the tubes, the inserts, because when you take in drugs, there are also inserts that they are going to use to get rid of the fungal infection, okay? These are the inserts. There are what we have clean fast. I'll be calling the brand name. We have clean fast, Clovinal. A lot of persons know that I've made video on Clovinal. I've made video on clean fast. I've made video on a lot of them, teaching people how to use them. Please, if you are joining me, like. It's not easy to be communicating without you giving me a thumbs up, okay? It's a free lecture. It's a free live stream. Give me a thumbs up. 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 Give me a thumbs up, okay? I'll be waiting for you. So we have the clean fast. We have the clean fast. I know I've dropped a video on clean fast. We have the clean fast. We have the Clovinal. We have the Clovinal. And also we have Gynamed. Gynamed, I've dropped a video on this ones before. We have Gynamed, and also I have Clinival V. Okay, I'm going to talk on these ones that I have with me one after the other. Okay, I'm not going to rush this video. I'm going to talk on them one after the other so that we are going to go along. But let me get what I'm coming. Whoa. Always hydrate yourself. I've hydrated myself. I was feeling dry and tasty, so I've hydrated myself. So, okay. So for the pregnant women, let's talk about the pregnant women and those that are breastfeeding. The pregnant women and those that are breastfeeding, look at the ones that are good for you. Clovinal, and Gynamed, and there is one also that is a mycotin. I know a lot of persons know that one, mycotin. I don't have that one right here, so I don't have the picture of that. Mycotin, it's spelled mycoten, mycotin, mycotin, inserts. Okay, look at the spelling there. It's spelled mycotin insert. Okay, there is one out there that is mycotin insert. That is also good for the pregnant woman and the breastfeeding mother. Why these ones are good for them is that this ones contains clotrimazole. Anyone that contains just clotrimazole is good for the pregnant woman and the lactating mother. Okay, clotrimazole, this clotrimazole 100 milligram, and this one too contain clotrimazole 100 milligram, but this contains metronidazole, which is, let's go on to free meal. So the metronidazole is good for the pregnant woman. We are in a serious phase now. The metronidazole is also good for the pregnant woman and the breastfeeding mom. So this contains 500 milligram of metronidazole and 100 milligram of clotrimazole. Okay, and also it contains a lactobacillus. Okay, lactobacillus spores. Okay, which is 150 millions. Okay, then what it means that it contains lactobacillus, it means that it does not kill the bacteria. Lactobacillus is a bacteria, okay, that is found in the vagina. Okay, this helps to strengthen the lactobacillus that is found in the vagina. Lactobacillus is a bacteria that is found in the vagina that helps to keep the vagina in a very good shape. Okay, lactobacillus help to destroy other microorganisms that wants to come into the vagina. Okay, so since this contains metronidazole, it have the likelihood of killing that lactobacillus, the bacteria. Okay, so what the producers does is now is that they then added lactobacillus spores in the production of this, so that it will be able to encourage the bacteria so that it won't die. I don't know if you're understanding. It's kind of trickish. I don't know if you're understanding, but I just hope you understand what I'm trying to say. Okay, so this is how the clovinal looks like. Look at it. This is how the clovinal looks like. Okay, it's for day 1, day 2, day 3, day 4, day 5, day 6, 6 days use. Every day to be inserted. One is to be inserted every day into the vagina. This does not usually come with insertion stick like these other ones that usually comes with this insertion tube, this tube. Okay, clovinal does not usually come with this insert tube. You can go get another one. This one is not that expensive. You can buy it and use it if you want to use it with the clovinal. Clovinal use is that when you want to use it after bathing, you wash your hands, and when you're about to sleep, you wash your hand properly, very well, because there are lots of bacteria, microorganisms that are found in the hand too. So you don't want to introduce other microorganisms to your hands. So you wash your hands very well and you insert it. Okay, that is how you insert this with your hand, and it's stored in the refrigerator. You store your clovinal in the refrigerator because the stuff here is very soft. It's very soft, so you don't put it outside in a place where the temperature is, or you know that there is so much heat in that place, it's gonna melt. Okay, so you're gonna put it in the fridge where the temperature is cold. Yeah, that is the best storage for this. Okay, so as I've told you, you wash your hands properly and you insert it only at night when you're about to sleep. Because if you go and insert it in the day, it will be as if the thing wants to fall off. Or hey, you'll be walking and you'll be saying, is it that the thing is falling off in my body? I beg. Okay, then you insert it only at night. Okay, then that is it. So this and this with the mycotin are very good for the pregnant women. Okay, then this Gynament, it comes in tablet form. Okay, you don't need to put it in the fridge, you don't need to put it anywhere, you just need to keep it at home and use it as you like. That is it about the Gynament. It comes in tablets. Look at it, the tablets. These are the tablets. Okay, so I'm going to teach you how to go with this one. Okay, let me cut out one tablet so that I will use it to teach you how to insert it. Okay, so that is it for this. Just contains only clotrimazole. It also has its own insertion tube with applicator. We call it applicator. Okay, so now this is Clean Fast. I've told you guys about Clean Fast before. Now, is this Clean Fast that the lady was asking? Please, if you're not pregnant and you're not breastfeeding, you know I've talked about the antifungal drugs. Now I'm talking about the inserts. Okay, these are the inserts. You can use all of these ones. This is Clinival. Clinival contains clindamycin and clotrimazole. Clindamycin is a very good antibacterial and clotrimazole is an antifungal. Why most of these drugs comes in this combination is because they've noticed that a lot of persons usually have mixed infection. Okay, there is mixed infection everywhere, so almost all these drugs usually comes in combination. So you can have antibacterial and antifungal present in one drug to help take care of you. So if you are the type that you haven't done any laboratory investigation, so you don't know if you're having mixed infection or you don't know if you just bacteria or just fungi, you straighten up, go use this one. But if you have done laboratory investigation and you know it's just pure fungal, ordinary fungal, just go and buy any of these ones that are just this one or mycotin that you just made for only the fungi. Okay, but if you have not done any tests, you don't know, but you are feeling the symptoms, please straighten up, get all these ones that are in combination. Though they are quite expensive because they comes in combination, they are quite expensive, but for your own good, so that you'll not be going to buy every month to treat yourself, you get these ones. Okay, these are the ones that comes in combination. There are a lot of other ones that are out there in the market that comes in combination, but these are the ones that I have in my premise that I can show you right now. That is why. Okay, so let me come to this. A lady was asking a question when I made video about this Clean Fast Forte. A lady was asking a question whether she would leave this pink tablet inside her vagina. Yes, now is this pink that is doing the work now? You see the gel that is on top of here? This is a gel. Okay, let me bring this other one too. This one too have the gel form, gel-like stuff. Look at it. Both of them have the gel-like stuff. The gel that you are seeing here is what is protecting the drug that is inside this capsule. So if this drug is meant to be just ordinary drug and it enters your vagina, I've already told you that there is a good bacteria in your vagina, okay, that prevents other bacteria from getting there or other things from getting there. So if this thing does not have this shell, this yellow gel-like stuff, and it's entered there, bam, this drug is going to be destroyed before you know it. Before it will even get to where that fungi is to kill it, is going to be destroyed. That is why it's produced in the gel, so that when this capsule gets into your body, it's the bacteria is going to destroy the gel of the capsule, while the tablet that is the active ingredient there will go and destroy the fungus. Okay, I hope you are getting it. So that is why this thing is there. So don't ask if you are going to be leaving this pink tube inside. This is not tube, this is capsules. These are capsules. Okay, these are vaginal capsules, so you are going to put them inside. This is what is going to do the effects in your body. So this is day 1, day 2. Sorry for the noise. It's where I am. Trucks, everything is passing. Okay. So this is day 1, day 2, day 3, day 4, day 5, day 6, day 7. 7 days good enough that they even wrote 1, 2, 3, 4, 5, 6, 7 in this one. If you can see properly, yeah, I think you'll be able to see that now. Okay. So they wrote it. That is how to use it. And even this too, this one is the Clinival. This is Clinival. They too made their own in capsule because they've known that they've added 2 ingredients. They too make their own in capsule form. Look at it. You are seeing the jelly. Sorry, I say in jelly-like form. You are seeing this jelly structure. You are going to put it in the vagina like that. And please, when you are using these drugs, no sexual intercourse with your partner. A guy, as a guy, you cannot insert. So for the insertion, I'm not talking to you guys. Your guys, your own are just the drugs. The drugs are meant for the guys. The drugs, and also we have infusions that you can go to the system, down straight to the system. The drugs and the infusions are made for the guys because you don't have where to insert the tubes. These insertion tablets. So these are for the insertion. Then yeah, someone was asking me how they are going to insert it. That is why I brought this one out. Okay, this is it. Please, if you are following me, like, I can see a lot of people entering the live like now. So this is the applicator and this is the tablet. I'm going to teach you guys because I already have a video where I taught everyone how to use this, but I'm still having the same questions. That is why I'm showing this again. Okay, this is the tablet. Okay, so this is the applicator, this is the tablet. This small applicator you're seeing here usually come with this Gynamed. Okay, this big one have its own applicator. This big one usually have its own applicator. Look at its applicator. See, so let me show you this one first. This big one, you push it out first, you push here down. Look at it. You can easily go. Look at it. You put it, you see, so you push it out first. When you push it out, look at it, it can stay. The next thing is to bring out the tablet. Bring out the tablet, put it inside like this. Put the tablet inside. I'm not going to open this because this is for sale. Okay, this is for sale. If you want, you can order it, I'll bring for you. Okay, it's for sale, so I'm not going to open it. You can put the tablet inside there. Then when you put the tablet inside, you hold it like this. Put this inside of your vagina. Put this inside of your vagina. You push it inside. When you have pushed it inside, the next thing you are going to do is you push this and it's going to give you that pop sound. Okay, it's going to give you that peps that something has gone off. So when you push it, when you push it inside, it means the drug has entered inside. Don't bother yourself how the drug enter or anything. Okay, for something like this to enter into the like this to your vagina, that means something has entered. Don't bother how far it has gone. Don't bother if it's going to fall. It's not going to fall. Okay, it's not going to fall. It's not going to do anything. So when you put it like this, you gently remove, only drag it out again. Drag it out, remove this thing, then you go and wash your applicator. Wash your applicator, even if it's Dettol or even if it's water, anything, you wash your applicator very well back and you put it for the next day. It's that simple. It's not hard. So this pink tube that people are calling this pink tablet, you will leave this pink tablet inside. I think somebody bought it and when she was using it, she was having issues. They say the tablet is coming back out. Maybe she did not push this thing inside. Maybe if, okay, let's say this is the whole of the vagina, maybe she just push it like this and push it inside. That is why the thing was coming out. So please, if you are watching this my live stream now, if you are seeing this video, you need to take it serious. Okay, look at it as I'm describing it. Look at it. You put it into the vagina. Put it, okay, let me say you've put the drug. Okay, let me say you've added the drug. Okay, look at it. I hope you are within time. Oh, glorious. Okay, so when you have added this inside, let's say when you have added this inside, this is it. You put it like this to a favorable distance before you push your drug inside. Okay, before you push your drug inside, look at it. This distance is not high enough. Okay, if let's now because I'm putting this my hand here as the vagina, let's say, okay, this distance is high enough. Okay, and don't say, is this thing not going to pain me? This is not going to pain you. You don't need lubricant, you don't need anything. If you say it's going to pain you, it's going to disturb you, you can buy lubricant and put it and use it, but it's not going to pain you, it's not going to do anything to your body. Okay, so you put it inside and it will be okay for you. As I said, this big one usually comes with this one. Okay, so that is clean fast fort. Okay, let me tell you the dynamic. So you first of all always disinfect your applicator. The applicator, always disinfect that applicator first. So I'm going to teach you the natural ways and the supplement, so you don't need to rush. Don't need to rush into the live stream and rush out. Okay, so this is for the dynamic. I'm doing this for the ladies that are not pregnant. This is still the same with this clinival. How to do it, they are still the same. Okay, look at this clinival. Look at where its applicator is hidden. Look at it. Look at it. It's still the small one because the tablets here are still small. Small one for small tablet, big one for big tablet. The manufacturers know what they are doing. Okay, so that is it. Then the Clovinal, I told you Clovinal does not have applicator. You can buy applicator or you use your hand. And also always put the Clovinal in the fridge. Okay, I know some people say, how would they open this Clovinal? Look at it. So Clovinal, look at it. Are you seeing this mouth? You open it, open it like this. The Clovinal will open. Look at the opening parts. Look at the two mouths. This is how to open the Clovinal. Okay, now that is it for the pregnant women. Clovinal and the Gynamed are there for you with mycotin. So let me teach you, the pregnant women, how to use the Gynamed. Look at the tablets. Okay, I'm using this tablet now. Look at the Gynamed tablet. This is to be inserted. Look at the shape. Are you seeing the shape of the tablet with the shape of the tube? You see why I said the manufacturers know what they're doing. Thank you for the like. Thank you for the like. Please keep liking. Thank you. Thank you. It encourages me, please. The shape of the tablet is equal to the shape of the tube. You see? So look at it. All you need to do is to drag it out like this. It's out. Then you put the tablet. Look at it. Oh, you put the Gynamed tablet. Let me see. Then you see it is already working. So you put the Gynamed tablet inside. Look at it. And they will say, this tablet is big. Can it? This tablet is big. Can it enter? You can see that it has already entered into it. So let's say this is our vagina. What you do is you shook it, put it inside. And you what? It's gonna fall off. You see? I hope you saw that reaction. I hope you saw that reaction. That is exactly what is going to happen. It's going to pop. You heard the pop sound. It's going to pop it inside of you. So my dear, don't be scared. Don't be asking me, how will it enter? How won't it enter? All you need to do is do your own and leave the rest for the drug. Okay? So guys, back to I showed you. You put it and you what? You put it inside of your vagina. So that is how you are going to do the Gynamed. This is for the Gynamed. So this is how you are going to insert for the Gynamed. Okay, so the Gynamed will have its own tube. All of them have their own applicators. I don't know why I'm calling it tube. Please, either I call it tube or applicator, know that I mean this applicator stuff. So they all have So this is how to use it. Is it hard? You can still drop your comment in the comment section, because when the video will upload, getting back to the questions will be quite somehow. So please, if you're joining me, say I have been talking. If you're joining me, say I, and say thank you if you like what I'm doing. Thank you if you like the nice work I'm doing. Months, I'm about months end. A lot of persons will be having 1 or 2 infections after their flow because of poor hygiene. You can still use these ones. Okay, so these are for the pregnant women and also for those that are not pregnant. Those that are not pregnant as a lady and you're not breastfeeding, your own is bang 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 bang. Okay, you can use all. But if you're pregnant and you're lactating, there are some limitations for you. Okay, there are some that you won't use. I've mentioned. If you want to know, go back and rewatch the video. You are going to get all. I will not keep talking about them over and over again. So those are the antifungal drugs, and I told you that there are some that also in infusion form. Okay, infusion that you can put through the vein. Yeah, they used to put it through the vein. That one is direct, more faster, and pam pam ASAP compared to the tablets. You know, tablets take a long time, but the infusions, okay? So the guys, I told you now, you're not going to insert, you're just going to be using only the drugs and some tablets. And also there are creams that you can use. There are creams that you can use for the itching. Yes, for the itching and the surface itching, there are creams that you can use. That means you have your canesten cream, you have your mycotin cream, a lot that can be used. Okay, so those ones are out there too. I don't know why I did not bring them, but they are over the counter. They are over the counter there. So these are the ones that I was able to bring. So you can also get the creams to itching, and that will be okay for the itching. So I hope I've taught you guys how to insert today again. So any questions that you want to ask, and I said please don't have any sexual intercourse while on these drugs. Finish your medications first before you have any sexual intercourse. Please, if you're joining me, like. Your like will give me a long way to go. Go like. Thank you for liking. Give a thumbs up. So now let's talk about the natural remedies. Yes, these natural remedies, you know now, after the drug therapy there are natural remedies. Okay, there are natural remedies that you have to practice so that you won't keep having this fungal infection up and down every month. You don't need to be having fungal every month. You don't need to keep poor hygiene to be having fungal infection every month. Okay, so the first natural way is that you should reduce your sugar intake. Okay, because the Candida feed on sugar. Oh, where are those persons that like carbonated drinks? Those ones that sound yeah, I've arrived. Or all those juice, how do you call it? My children, some the children will say juice. All those juice that are very sugary. The Candida likes to feed on sugar. Okay, so if they feed on sugar, they are going to overgrow. Deworm yourself regularly. Candida likes to feed on sugar, and if they feed on sugar, they are going to overgrow and cause candida infection. So reduce your intake of sugar, reduce your intake of carbonated drink, but rather, number 2, you should increase your consumption of probiotic rich food. Okay, there are some food that are rich in probiotics. Okay, like your onion that a lot of persons hate. Increase the use of onion. Increase your intake of yogurt. Okay, instead of you to buy the carbonated drinks, why don't you get yogurt? Okay, yogurt is quite expensive than the carbonated drinks, but at least you can save. Since the carbonated drinks are causing more harm, you can like save 2 bottles of the carbonated drinks that you want to drink and use it and buy 1 bottle of yogurt. That is gonna go a good way. That is gonna go a good way. So you should increase the consumption of probiotic rich foods such as yogurt, onion, fermented vegetables, fermented vegetables, okay, like the fermented garbage, fermented cucumbers, lemons, carrots, garlic, okay. Garlic also have some antifungal properties. Yes, garlic have rich antibacterial and antifungal properties, okay. So you can take them even though garlic smells, but you can, if you don't like garlic like me that don't like the garlic, you can take yogurt, you can take cabbage, cucumbers, and also you can take onion. I like onion. If you don't like onion, I like onion, okay. So you can make good onion, you know, that type that you will use onion to cook and you will not keep all the onion, you just make it crunchy. You can make it for your guy, because I told you that candida can be for the men, the woman, the pregnant women, yeah. So you can give it to your guy, give it to yourself. Two of you are going to be preventing the candida together in a mutual way, you know that. In a prevent, it's gonna be a sweeter thing because two of you are doing it together rather than only you taking it, okay. Yogurt, you can buy it for him too, or even him too can buy for you. Both of you can buy for yourselves, or you carry yourself and go and buy. And also lemons too are good too, okay. Lemons are very good. Then thirdly, I want you to take okay, I will keep this third for the supplement, okay. And thirdly, I want you to take keke na pepper. I would like you to take antifungal food, okay, antifungal food that are foods that are rich in antifungal activities. I've mentioned this, such as garlic. Garlic has a lot of antifungal activities, okay. So take food that are rich in antifungal activities, okay. You can take garlic, you can take clove oil and coconut oil. I've seen coconut oil a lot in the market. I've seen coconut oil. So probably for those that have a candida infection of the skin, probably if you're having some skin infection that are caused by candida, the best is to rub coconut oil or clove oil on those parts. Yes, I hope you're getting what I'm getting. I hope you're understanding. So if you are the type that you know you are following this my live stream and you are having skin infections, yeah, skin infection, and you know that is as a result of fungi, okay, your vagina is itching you and is as a result of fungi, the natural remedies, go and buy coconut oil. It's not expensive. I know it's not expensive in the market. Go and get coconut oil and rub on the surface, okay, so that itching and that's all that we go off, okay. So because it contains high content of antifungals, okay, antifungal activities. So fourthly, I would like you to practice good hygiene. I've told you now, practice good hygiene now. Weird things like me now, I'm putting on this trouser that is very free. I'm not putting on trouser that is tight. Thank you for the like. Oh, thank you. All this my talk as you're joining me, like now, wear things that are very free, that gives air fitting, okay. I'm gonna wear tight, you know, all these what did they call them, is it genji or what, all these days ladies, they like tight. Even when you're sleeping, please don't put on anything. I've made a video on this. I've made a video, it's in my page, I've made a video, sleep naked. I've made a video. Is it that you should sleep naked or this? You can go and check it out. I said sleep naked. Don't put on clothing while sleeping. Sleep naked. Unless if you're in the area that you know that bad boys or those good boys are always disturbing the area. You can put on light clothing. Okay, you can put on like boxers, not or shorts that will give free air to your body. Okay. I know you get what I'm saying. Then change your pads. Say, oh, months have ended. Month was about to end before. You know how they be na ladies. Month was about to end. The period man came. Month has ended. Some people, the period man is already here. Then some people in the middle of the month again. Period man. Different days for different people, okay. Our faces are not the same, so try to change your pad regularly, okay. The worst, I know somebody, how many times can we change our pad? The worst you can do is morning and evening. Okay, the worst you can do is morning and evening, but try to elevate yourself to be more than morning and evening. You can just do it three, change your pad 3 times a day. Okay, but if you want to be a peak of your hygiene 4 times a day. Okay, and if you're the type that you know your flow is high, when you're flowing, okay, you go to the bedroom, you wee, because you're on your period, you go to the bedroom, listen, you wee. All you need to do is after that weeing, okay, because you know you don't wee every hour. So after that weeing, you quickly change your pad. If your flow is big, you change your pad. But if your flow is light, and you don't want to change your pad, you knit up, you clean yourself, damp yourself to be dried. Don't just wee, finish weeing, wash. If you know you are washing self, you and I know that the water will still touch your body, and you just broke back where your this thing. No, I think every lady should have this small towel or their small stuff in their handbag that they can be using to wipe. Or if you are the type that don't use public toilet, you can just have it in your house and you can be using it to wipe yourself after urinating. Now these days I've noticed that a lot of trend is going on that they are using cotton wool. Cotton wool is douching. That is douching. Like, is it douching or douching? How did they call it? But I think it's douching. Using cotton wool. It's just like you putting your hand in your body and be washing. Only that too, because there is staphylococcus in the hand. Like, you see, if these hands that you are seeing here, I just put it in the microscope, you'll be seeing staphylococcus all around. So if you are using this, how you are using, putting this, even pad we are using, you and I know we don't put pad inside our body. We put the pad on our panties and the blood will fall on the pants. But you are the type that you are using cotton wool and you are putting it inside of your body. That is douching. Abi whatever. Anyhow you want to pronounce it, but that is very bad. Please, ladies, this new trend of using cotton wool, I don't know where the one came from, but it's douching. Please, you don't know the neatness of this cotton wool. This cotton wool that even we health providers are using, we are still adding methylated spirits. We don't just use ordinary cotton wool to go and clean the surface before we do what we want to do. We still add methylated spirit so that you're able to disinfect the place first before we are using. And you are using cotton wool that you don't even know the production. You go and put it inside your wonderful body because my dear, it's douche, and it's not good. But if you want to continue, who am I to stop you? So please wear breathable on this. Like, I hope this dashing did not spoil your mood. Please like. So wear breathable on this. I've told you before now. Wear things that will allow free air into your vagina so that the candida can be happy and swim very well. And for those persons that are always stressed, I'm not always stressed, but there are sometimes stressed like me. Please manage your stress, okay? Manage your stress. Stress can weaken the immune system, and when your immune system is weakened, you know what will happen now? All the opportunity organism will be eating you, pam, 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 and all what you know is that another serious infection have come. So manage your stress, so manage stress very well. Then let's talk about the supplements. All this I'm talking, nobody's dropping comments. What do you want me to do? Drop your comments. So thank you. So you can manage your stress because it can weaken your immune system. Now let's talk about the supplement, okay? Supplement, there are prebiotics. So there are prebiotics. Supplement that you can use to prevent candida infection, to prevent reoccurrence of candida infection. One, probiotics. Probiotics, spelled probiotics. Probiotics. You can take a supplement or you eat food that are rich in probiotics. I've already told you food that are rich in probiotics, and for some persons that usually have fungal infection of the gut, these probiotics are also good for them. Okay, I've already mentioned some food like the fermented vegetables, the yogurt, the onion that are very good probiotics. Okay, you can go to your pharmacy. Yes, go to your pharmacy. There's a probiotics, but that is quite expensive. I've dropped that's on my listing before. You can go and get your probiotic supplements, take it daily. It's quite expensive, but it's very good. At least the money that you use to buy a supplement, it's better you buy the supplement. I can say for free for that some persons treat that every month. Okay, so you can take. Then also vitamin C 1000 milligram, strength of vitamin C 1000 milligram. I've made a lot of video on that before. You can take high strength of vitamin C 1000 milligram to help boost your immune system. Okay, it's taken daily, but if you are the person that you have stomach ulcer, you have to eat very well before you take this 1000 milligram of vitamin C. If you know that you cannot take the 1000 milligram, there are also 500 milligram that you can take. You can also take 500 milligram is there, you can buy and take. Okay, then the second supplement you need, or the third supplement, I've mentioned probiotics, I've mentioned vitamin C to help boost your immune system. Okay, and also the third one is zinc supplement. Zinc supplement comes in 50 milligram, 100 milligram. Okay, depending on the one that you can get zinc supplements and use it on a daily basis. It's going to help remove that bacteria infection and also this candida infection that we are talking about. Okay, so I've mentioned probiotics is in a cup like that. I know a lot of people have seen this. I'm going to drop that in the community. I'm going to drop picture of probiotics in the community. It's in a cup like that. Then also vitamin C. A lot of persons know vitamin C 1000 milligram. You have the one that is effervescent. Those ones that when you put it in the water, it will just and it will dissolve. We have those ones. We also have the 500 milligram, the 1000 milligram. I know a lot of persons know vitamin C. It's raining over here, so I need to increase my voice now so that you can hear very well. Then also zinc. You can take the 50 milligram or the 100 milligram on a daily basis. You can take the 50 on the 100 milligram on the daily basis. Then the final one is omega-3 fatty acid. Okay, omega-3 fatty acid, the fish oil. Some people say, which one is omega-3 fatty acid now? Supplement. Omega-3 fatty acid is fish oil. I have that one. Okay, I have that one. Omega-3 fatty acid is very good because it contains antiviral, antifungal, and also antibacterial properties, and it contains antioxidant properties that is going to help boost your immune system and also keep your VG in check and destroy that unhealthy growth of the candida, okay, that is causing the infection. Okay, so for pregnant women, can I take these supplements if I'm pregnant? No, it's a no. I've been talking about the pregnant woman and the person and the lactating one too. For those that are pregnant, for those that are lactating, these supplements that I just mentioned are not made for you. Sorry. All you need to do is take vitamin C. Okay, your antenatal vitamin C that is 100 milligram. Okay, you can keep taking your 100 milligram 2 to 3 times a day to help boost your immunity. Okay, that is okay for you. The zinc is not made for you. The probiotics is not made for you, and the omega-3 fatty acid. And a pregnant woman take that. I don't know for now. I have to check out that one. Okay, I have to check out that one. If you can take it, even the zinc, I have to check it out. But that is all for now. Pregnant women, I told you these drugs are not meant for you. The tablets are not meant for you. I've already told you what to use. If you are confused on anyone, go back, rewatch the video. Take time, watch the video. assimilate it, and you get the information very well. Let me get you the omega-3 fatty acid so that you can get a quick view of how it is. Whoa, me back and back. So look at it here. I hope you're seeing it. Omega-3. This is it. Omega-3 fish oil. So this is how the capsules are. It's in a capsule from some. You can get it one daily. One daily you can get this. You can get the probiotics, and also you can get the zinc supplements, and you'll be good to go. A daily use of this, a daily use of probiotic, and also a daily use of zinc supplement. You are good to get your flora, your normal flora in your vagina. You're going to balance everywhere. You're going to keep everywhere in check. And even for the guy, good for you, especially this zinc, because it helps to increase your sperm boost. Okay, your sperm count, your sperm boom. This vitamin C and the zinc are very, 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 very essential and very good. Okay, so if you are the type that you're looking for a way to boost your sperm level, your sperm quality, quantity, and motility, you need this supplement also. Okay, you need a supplement of zinc, and you need a supplement of omega-3 fatty acids. Sorry, you need a supplement of zinc and vitamin C. Please, the probiotics are not for you men. Okay, the probiotics are not for you men, but the zinc and the vitamin C 1000 milligram are made for you men. Okay, it's going to help boost your sperm quality, your sperm quality, your sperm fertility, your sperm, every it's going to help that, and you have good quality sperm. Okay, someone have already said please like, I've been saying, talking a lot, and a lot. You can go back and view the video. If you don't understand all I've been saying, you can go back and view the video. Thank you for joining. Thank you for joining. Thank you for the like. Okay, today has been a long day because I've won again douching. Is it douching or douching? You can correct me. Douching, DOUCHING. Those that dodge with cotton wool. Thank God I was able to remember that, to tell them that this cotton wool they are using to put in their body, because you don't know where it's come from. So please don't listen. So a quick recap. I told you guys about Candida, what causes it, the symptoms, how to treat it with drugs, with the antifungals, the tablet, the insert, the creams. I told you. I even taught you how to use the insert. Today is just like self-explanatory video. You can even just go and get it. So I also taught you how to use the insert, and also I taught you natural ways that you can prevent, or natural way you can use your body to help to get rid of this fungi. And also I taught you the supplements that you need. Where are you from? I'm from Nigeria. And also the supplements that you need. Okay, and one thing again is that steaming. Is this steaming of the vagina? I'm from Nigeria. I can't even pronounce your name. Zing. Okay, I can't pronounce the name. I'm from Nigeria. And one thing I want to tell you about is dowshing. Okay, so this year, some pregnant persons, people. I also talked about pregnant people. Oh, who took their life back again? You like and you took it back, huh? That's your business. So, also, okay, you're from Iraq. Okay, thank you for joining from Iraq. How are you in Iraq? I hope everything is calm over there. I hope you all are doing well over there. This is from Nigeria. I hope you all are doing well over there. Welcome. Thank you. Thank you. Thank you. Thank you. Network is bad. Network was over there. Please like. Network is disturbing. You're beautiful. Thank you. Thank you, ma. You're also beautiful. Thank you, ma. Thank you, ma. So steaming of the vagina is not good. I made a video about steaming of the vagina and I put it down there. I talked about the disadvantage of steaming of the vagina, that it helps to kill the lactobacillus that I just mentioned that is found in your vagina. It helps to destroy that lactobacillus, and lactobacillus is a very good bacteria. It helps to destroy it, so it's not good. And also I told you that there are a lot of dangerous things that are involved in steaming of the vagina. Steaming of the vagina also causes this candida infection. Don't think that steaming of the vagina removes candida infection. It causes candida infection also. So steaming of the vagina is not advisable. Okay, please don't do that. Thank you, this beautiful lady. So what am I going to call you now? I'm just seeing your face as a lady. I don't know what to call you. Uh-oh. Are you 18 years old? Seriously? I'm not 18 years old though. I'm an adult. I'm an adult. I'm an adult. I'm an adult. I'm not 18 years old. Oh God, I'm an adult. I'm not 18 years old. How can I be 18 years old? Okay, so thank you. Please like. I'm not 18 years old, but adult. So how old are you? You that you're viewing me, I don't even know your name. How to call your name? How old are you? So that is it. So don't steam, don't douche. Cotton wool users. Cotton wool users, say no to cotton wool. I beg, the pad that you used to put on top of your panties. So I'm very small in shape. I'm not small, I beg, I'm big. Okay, I'm not small, I'm big. Okay, I'm not small, I'm big. Maybe it's the camera and where you're watching me from that makes me look small. But I'm big, okay? So stop douching. If I'm 18 years below you, I wouldn't be speaking this thing now. I will not be talking about douching, vagina. I won't be talking about all those that. So I'm a full-blown adult with a lot of kids. So stop douching, stop steaming your vagina, and stop doing unnecessary things to your body that are not good for you. You speak Arabic? No, I don't speak that. I'm not from Arabic, I'm from Nigeria, so I don't speak Arabic. I speak Nigerian language. I speak Nigerian language. I can't speak Arabic. I'm not from Arabic country, so I don't speak that. Thank you. I speak Nigeria English language, which is not even our language though, but the general language, the English language. I can't speak that. So thank you guys for joining. Drop your questions. I want to answer some questions on this live. I want to answer some questions. It's almost to 30 minutes. You know, I said we'll do 1 hour 30 minutes. Like. It's almost 30 minutes. Drop some questions. Let's answer some questions. Like, subscribe. Please like, subscribe. Comment, share. share it or keep save this video and share it. I'm still going to drop a short about the drugs that you can use for pains during menstrual cramps. I'm going to drop a short, okay? So watch out for the shots that I'm going to drop on drugs that you can use for menstrual cramps. Watch out for that shot, okay? So please, this beautiful lady from Iraq, like, join. You can join. You can subscribe to my channel. You can like, subscribe to my channel, and follow me for more, okay? Thank you for joining. No questions? Okay, so we are having how many minutes to close this live? Today was a wonderful one. It was a full packed wonderful one because everything that you needed to know is in this video. All the Candida question that you want to ask, pregnant people, can they take this, can they take that? I've shown you all the ones that pregnant people can take. I've shown you every. So this video, this live 1 hour 30 minutes live is a full pack. So you can go back. I'm sorry, but I don't speak English well. Okay, sorry about that. I will understand anyone you bring. Anything you say, I will understand, so we can just talk in the little we can, okay? I can't speak Arab because I'm not from that country. I speak Nigerian language. I can speak English, so you can still check on my bio and DM. Then let's see if you can do normal English. Okay, so this video was a very self-explanatory because I brought down a lot of things. Imagine, I even taught you how to use insert. And also, I hope I told you that you shouldn't have sexual intercourse while on these drugs. Please, no sexual intercourse with your partner while on these drugs, okay? So all that was mentioned on this video. Thank you all for staying. Thank you. This video, you need to go and sit down, relax, and watch this video. Then you've stopped seeing your menstrual flow and you are feeling some funky, funny, symptoms down there. You can go and watch this live stream. And know what to do to your body. So this was a free lecture that I was expecting a lot of likes, but we're having it. So thank you. Like, subscribe. It's a free lecture. You can save it. Okay? So save it. You can follow me on TikTok, follow me on Facebook, follow me on especially YouTube, my home. Follow me and we'll get it up very well. Okay? This lady, I can't even call your name because it's written in Arabic. So yeah, thank you for joining me. You can follow me on Facebook, you can follow me on TikTok, and also you can shut me up YouTube and we talk more. Yup, you have 3 minutes. Okay, let's use the 3 minutes to relax and wait for patience. Nobody has patience. You. Oh, thank you for joining. Thank you for liking. Nobody disturbed. It's a beautiful day. Feel good to be a winner. This mic is dead. I need to charge it. Many lives today. Many other things free, but I'm alive to give you praise. I need to charge this mic. I even think the lady cheated me. King of glory, everlasting Father, I wrote this song from you, from my heart, to give you praise. Oh, Baba, so guys, you can order, oh please, you can order from any part of the country you are. You can order, order your supplements, order your drugs, order, even though you are not liking, order. I'm going to talk about ulcer. So no questions so far, so good. I've spent 1 hour 30 minutes on this live today. So thank you guys for staying tuned till the end. You can order for your supplement, order for your drugs, order for your supplement. I'll see you next time right on the channel. So next time, same place, same time. I'm gonna give you time. You all are gonna join me. See you next time on this beautiful channel as we share our thoughts, my lifestyle, everything about your health and all your health questions. Like if you have not liked, like, and see you next time. Don't forget to share this video to tell your friend. Take care. Bye. Let's end this live.